That code was unreal. I had no idea you give epinephrine after the first defibrillation in a shockable rhythm. There are multiple studies that show worse outcomes if you give epinephrine before. Good to know. Can we go over epinephrine a little more? Sure, what do you want to know? Let's start from the beginning. Epinephrine stimulates adrenergic receptors, so alpha-1 receptors increases vasoconstriction, heart rate, and myocardial contractility. I remember that because alpha-1, heart, stimulation of beta-1 receptors also helps contractility, and beta-2 receptors causes bronchodilation. And we mostly always use it in codes, right? Every 3 to 5 minutes because the half-life is less than 5 minutes, and it's the only med you can use regardless of rhythm. Regardless of rhythm, so 𝗕𝗵𝗵, asystole, 𝗕𝗐𝗃, all those scary rhythms we can use it? Yep, there's no contraindications. It's also used for croup, asthma exacerbations, hypotension, and anaphylaxis. Yes, beta-2, 2 lungs, bronchodilation, totally makes sense, especially for anaphylaxis. It also helps block the release of inflammatory substances. Epinephrine is by far the most important med in anaphylaxis. Got it. Just remember it comes in different concentrations. The anaphylaxis dose is less than cardiac arrest, and crash cards carry the full cardiac arrest dose, which is 1 milligram in 10 milliliters. Why are they different? You want to use a lower dose in anaphylaxis and typically IM as well to lower the risk of cardiac complications. All right, thank you. Wait, I'm not done. Sorry, I'm serious. You have to make sure you use the correct dosing, concentration, and route. It can be very different. For example, croup, you use a nebulizer. Oh, really? Yes, and I know in cardiac arrest, we give the IV bolus real quick, but another important thing is if you have an infant or a child in anaphylaxis, you never want to give a bolus. You do IM or a slow infusion if the IM doesn't work. Because IV has more risk for cardiac complications. Exactly. Remind me again where epinephrine goes if we give it IM? The vastus lateralis. The mid-outer thigh. What about the side effects? Well, epinephrine is adrenaline, so what do you think? Adrenaline, so anxiety, palpitations, tachycardia, tremors, hypertension, dizziness? Good. The side effects stem from the fight or flight response that comes from the epinephrine, aka the adrenaline. Anything else good to know? MAOIs prolong epinephrine duration, and try to use a central line if you're doing a continuous infusion. Okay, now I'm done.